Our company, Kelly, focuses on coming up with solutions for very complex public health threats, like chemical and biologic threats that you mentioned, plus emerging infectious diseases, and more recently, the treatments for opioid overdoses. So we acquired Narcan nasal spray last year, specifically looking at how we as a company can help the fact that there are 33 million Americans today who are at risk of an opioid overdose. Those kind of fall into two different categories. There's a category of 21 million individuals who are on prescription opioids today legally.
Okay.
And then there's another 12 million individuals who are either taking heroin or illicitly using other prescriptions.
Yeah.
So, I mean, our focus is on protecting that 33 million population.
Do you make money on Narcan? Because one of the concerns, not concerns, but one of the things people want to make sure of in states across the country is that they have access to Narcan cheaply so that they can be administered effectively, to your point. Is this something that you guys can look to as a profit center, or do you have to provide it at somewhat of a loss?
Well, we have two different channels of distribution. So there's a distribution channel that goes to the public interest market. So by that I mean federal, state, and local customers and patients. And then there's the typical commercial market. So the product is priced differently for those two markets. We offer to federal, state, and local customers a 40% discount to the commercial price. And then in the commercial market, where the product is widely available in all pharmacies around the United States today under a standing order, it's made available at a very low copay per dose. So our focus is on affordable access and education of that 33 million patient group who needs access to some form of naloxone.
One final question on Narcan, which is, how are we doing in fighting the opioid crisis today? There's a lot of attention, there's a lot of lawsuits, there's a lot of money being thrown at this problem. Narcan, obviously, a big part of helping. Of course, some say it helps and then it hurts again because it allows people to keep using. Have we turned the tide at all when it comes to fighting opioid addiction?
I think we're making progress, Kelly. We have more work to do. I think this opioid epidemic is still evolving, it's still maturing, and it's taking various twists and turns. Our focus with Narcan, again, is to make sure that product is available to that 33 million patient group who really needs access to the product to save lives.
So broadening out from that, there's been a lot of talk in D.C. about drug prices as one area of kind of bipartisan agreement, that they're too high, that they need to be more transparent, that maybe the distributors or the rebate system is to blame, and that something needs to be done about it. Explain, quickly, you guys have a lot of amazing stuff in development here. We're talking about vaccines for Zika, vaccines for anthrax, Ebola, many different treatments that you've worked on. How costly is that to develop? And what concerns do you have about the way this drug price sort of reform could go?
Sure. So if I look back at our 20-year history of developing and making available these different products for chemical and biologic threats, as well as the emerging infectious disease, our focus is always on fair and reasonable pricing, looking at our customers' needs and making sure that through the pricing mechanism, we can earn a reasonable profit so we can plow back those investments in our infrastructure. One of the common themes across all these public health threat categories is the fact that it really requires a strong partnership between public and private industry. We have a 20-year history and track record of forming those partnerships.
Is there one thing that could be done to help the sort of convoluted system in your view?
Sure. I think back on the opioid issue, I think the awareness and education of that 33 million patient group to understand how important it is to have readily available products like naloxone products, Narcan in particular, to that patient group is critically important to saving lives.
All right.